Today's webinar, we will focusing on the intersex life experience from age 0 to 10, specifically examining the key people and the environments surrounding them during this formative period. We are pleased to feature four panelists representing the perspective of a doctor, a caregiver, an educator, and an intersex individual. Now, okay, I think it's done for the 101. Now, let me introduce our first panelist, Dr. Kanishka Das. Dr. Kanishka Das is a distinguished pediatric surgeon, formerly serving as a professor and head of pediatric surgery at AIIMS, Bhubaneswar, and St. John's Medical College, Bangalore. His extensive expert includes differences in sex development, pediatric urology, and critical care, complemented by over 100 scientific publications and numerous awards. He is also a founding member of the Society for Children with DSD, India, and served as its secretary. Welcome, Dr. Kanishka Das. Thanks for joining this webinar. I think doctors, play a key role when an intersex baby is born that can defend their rights to health. A newborn is at their most vulnerable stage of life. We have often heard that the birth of an intersex baby was considered an emergency by hospitals. Being an intersex person myself, I personally feel that an emergency medical protocol is not necessary for all intersex newborns, but only for those with genuine healthcare concern. However, I understand such a protocol likely exists, and it has been shifted in recent years. Therefore, could you please share it with us? What are the current medical protocols for intersex newborns? What paradigm shift occurred? How were they mobilized, and what challenges did doctors face in adopting them? Are these new protocols universally followed by all doctors? Doctor, over to you.
Yeah, thank you very much, Hiker. I will go through these one by one. Yes, for a long time, birth of a child with DSD, which is differences in sex development, was considered as a medico-social emergency. The medical emergency part has has its own connotations, and the social emergency has its own. As of now, we are fairly sure that the medical emergency part pertains to very specific things. One in which there are changes in the body that can be life threatening, as in the common form of DSD, adrenal hyperplasia, where we need to treat them immediately so that they do not go into dehydration, dyselectrolytemia, and lose life. So that is one very big chunk of DSD. The other ones are where there can be a potential obstruction to the flow of urine or the flow of genital secretions, and they can lead to effects on the major organ systems, notably the kidneys and the genital tract, peritoneal cavity. So they also have to be tackled. So, as far as it goes, these are the absolute emergencies that we as medical professionals need to deal with in these children. But the rest of them, vast majority of them, like you said, are not emergent conditions, and they can be dealt with very slowly in a well paced manner. The social emergency part, it varies across the world. In situations like ours, societies like ours in India, where immediately the families want to know whether it is a boy or a girl, as in the conventional binary sex assignment, and they are sort of pressed by society, by everyone else, sort of to declare what the baby is. So in that sense, it has been termed as a social emergency. But after we have known a lot about the natural history of these various disorders, there's a spectrum in there, as you mentioned. We know that we can take time, get things settled, and then give the choices to the parents to decide what to do. It is very important that they have their choices. And now, of course, if you can wait long enough till the child himself or herself or itself, whatever, comes to a situation where they can opt for thing, and then we leave it till then. So that is how we stand today after changes in our knowledge, in our experience with these children as they grow up into adulthood, looking at their lives, the problems they have had or not had. So that is how it has changed our management over the years. Yet another thing that we have also known now is that we have come to learn of some disorders, some of these atypical ones, which we know are going to turn in a particular direction later. They have been characterized very well, some of these. So those are the ones which we need to identify in the newborn period so that we can medically manage them to that extent, like 5 alpha reductase, 17 beta HSC. There are very specific ones which we know. So, like you said, yes, there has been a paradigm shift. Our normal or abnormal or atypical, which we used to consider earlier, is not the same now. It varies with the society too, and we need to take that into our fold as we do it. So, and does everyone follow this? Unfortunately, the knowledge and practice of DST is restricted to a very niche group of practitioners who specialize in it. So, in most places, when they have situations like this, they refer to the apex institution in that area where there is a group who look after this specifically, which is a multidisciplinary group who are going to deliberate very carefully on the particular case in general, and in particular look at the pros and cons and find the most non-invasive way of managing the child and carving out a life for the child, a very fruitful life. After all of us aim that these children are going to grow up to be socially productive adults. That is what we all aim at. Okay, so this is how our things have moved in the last few years, and protocols are still being adopted both abroad and in our country, India. In India, in fact, we have a legal stand now that everything has to go through a multidisciplinary clinic, which group which has all these people, including the ethicist, the legal personnel, the medical personnel, and so on. So that is where we stand.
Wow, it sounds like good news that the protocol is changed and accepted by doctors. But I think believe in many Asia country they still haven't changed that. So I think we really need build a bridge, between other Asia country, especially within doctors in India, that already adopt this the intersex friendly medical protocol for intersex children. Okay, and I have a second question. I strongly believe that doctors and parents should safeguard the best benefit for intersex newborn to secure their rights of bodily autonomy, integrity, and self-determination. But uh, there's a dilemma uh, when parents, pressured by society, stigma, express shame and fear and request normalization surgery for their intersex infant, how do doctors typically respond? And what core guiding principle inform the decision of medical professional in these critical moments? Could you share some scenario with that?
Yes. Now, again, to go back to our previous discussion, a few years ago, we might have responded to the same situation a little differently than we do now because times are changing, the social structure, their understanding, everything is changing. But what remains is that, at least in India, in our conservative society that we have here, there is still not an acceptance of an atypical, a child with an atypical genitalia or a differences in sex development, and they will need time and space to come into accepting that. So there are still parents and grandparents and homes and families and societies that press on them for an imminent step to be taken. Now, there are some which are overwhelming, like a child with congenital adrenal hyperplasia, a very common scenario, who has a large phallic structure. And they cannot send this, despite the medical control, etc. They find it difficult to send this child to school, to integrate with other children, etc., and so on. So there, the parents are hard pressed to sort of seek an intervention for a reduction of the phallic structure, what we call clitoroplasty in the medical terms. Now, that is something that we take up to the committee and we decide to do it if the parents are very much for it and they have a genuine social construct which they want to have for the well-being of the child. And we have an assessment by the psychologist which also confirms that yes, there is a feminine gender, and the child also attunes itself to that. So there is a situation where there is a case for a clitoral reduction so that the child can go about doing the activities of daily life in school, in society, in school, at play, etc. But in the same situation, another child might with congenital adrenal hyperplasia might have a common passage for urine and for the vagina. Now that we need not tackle early in life. Earlier, we used to tackle it early in life in the second or third year. Now, we don't do that anymore. We let it be till the child grows up and then has his or her own opinion on that, and we tackle it at a later life. So, this is how things have changed over time with more understanding of how these children grow up, what is it that they want in later life. Many of them, some of them have come back to say that things could have been managed differently. Many of them have been happy. So we have more and more of these natural histories and long-term follow-ups and results being documented now in world literature. It's only in the last 20 years that we have some studies, long-term studies telling us about these things. So that is how things have changed. But yes, there is a pressing concern that in our conservative society, I can speak of India at large, they are not very keen to accept to let things be as they are for a long time. So we need to have a dialogue with them, get them to understand the nitty gritties of that, and yes, if they agree to wait, we wait. And if everyone thinks that in the body, in the multidisciplinary thing, that it is best to wait and it is safe to wait, very importantly, it is safe to wait, and the child's organ systems do not suffer any damage in the interim, then we wait and we do not do anything till the child is of an age of consent. And in those in whom it is absolutely necessary and we get a go ahead from the group that yes, we go ahead and do these minor surgeries, but no irreversible surgery, nothing to sort of alter the gonad, etc. We don't. But there are situations where the gonad can be taking a malignant term. That is where we strongly give them the figures that yes, we need to save the child. Hence, we need to take them out at a particular age as per scientific dictates. So that is where we stand now. We are clear on many things, but we are not clear on some things. And certainly, more experience with these children, their natural history, their psychological, etc., things when they grow up would help us in the future.
Wow, thank you so much. We really hope that the parents can really follow your stand, to secure the rights for intersex children. Because at this moment, this is we cannot say anything. Yeah, thanks for doctors. Have this understanding. I hope this you can help us. To spread this idea and uh, position to more and more doctor, not only in Asia but around the world.
Definitely.
Okay, thank you, Doctor. Uh, Okay, then I will. Okay, so I will go to the introduce the next panelist. Okay, after the intersex babies grow up, I think parents is another key pillar that we count on. I want to introduce Rino. Rino is a mother of an intersex child from Greece, who will share her experience as a caretaker. Rinio is a Greek intersectional feminist and a human rights activist, parent of an intersex youth, and MA candidate in gender studies, co-founder of Intersex Greece, member of Proud Parents and the Rainbow School. She has been active since 2013 on community building, public education, policy advocacy, and toolkit informative translation promoting intersex and LGBTQI+ youth rights. Speaking at venues including TEDx and the Greek Parliament and the Council of Europe. Wow. Let's welcome Rinio. Dear Rinio, it's our honor to have you here with us. Parents' voices of intersex children are not heard often. I think you also need a great courage to stand up and speak out. I understand that you have been a very supportive parent to your intersex child and stood up to mobilize the founding of the first intersex organization in Greece and even made a law to protect intersex human rights in Greece. We want to listen to your experience as a mother of an intersex child, about what challenges did you face when you were informed you have an intersex child? What can be improved in communication from doctors that is truly helpful for parents? Over to
Thank you
you.
very much. Thank you very much, dear Hiker. I'm happy to be here with you today. Uh, Actually, I'm amazed that we have this conversation, including doctors, which is something in Greece we don't have yet. So when I was first informed that I was expecting an intersex child, I had never heard the word intersex before, and I didn't even heard it at all back then. Greek doctors are still today not saying the term intersex, preferring the pathologized term DSD as disorders of sex development, not even differences. So I became a parent in a society that deeply assumes a strict sex and gender binary, and I was completely unprepared for what followed. At the fifth month of my pregnancy, doctors suggested, two of them actually, strongly suggested that because my baby in amnio showed to have XXY chromosomes instead of XY or XX, I should terminate a much wanted pregnancy, describing my baby as a mistake of nature, as a freak and a monster of nature. That moment was a giant shock, but also it was a turning point for us. We started asking questions, educating ourselves, me and my spouse, and we came into a contact with a global XXY community at first. With people like my child. Without realizing it at the time, I became an activist simply because I wanted to open roads, to open paths for my child to live, to learn, and to exist with dignity in the society. Very soon, through testimonies from other families, I learned that mine was not an isolated experience. The termination of desired intersex pregnancies is often presented as a medical protocol. In the case of XXY fetuses, the percentage skyrockets, reaches 75 to 80% in Greece and other Western countries. Many families are pushed toward abortion purely because of unjustified pathologization of chromosomal intersex variations and just to follow the sex norms and stereotypes. So I realized early on that this is an invisible kind of genocide that needs to stop. Instead of hearing, congratulations, you're expecting a healthy intersex baby, I was told that I'm carrying a boy with a problem, but don't worry, we can fix it with a little testosterone, which was also untrue in the end. And I know that if my child had also been anatomically intersex, I would almost certainly have been pressured into so-called normalizing surgeries, IGM, that is irreversible intersex genital mutilation, just as many other parents still are advised to consent to globally. So what do we need to change in doctors' communication? Firstly, to stop pathologizing difference. Intersex traits are natural human variations, not medical emergencies. At least most of them aren't, as we heard from Dr. Kanishka. Secondly, to use accurate nonviolent language. We parents should never hear terms like mistake, defect, monster, or problem when our child is really healthy. Thirdly, we need to be provided with balanced, rights-based information. Doctors should explain that most intersex children do not need medical interventions and that postponing irreversible decisions protects the child's bodily autonomy and future consent. And finally, to connect as parents with intersex communities and peer support, instead of isolating us in fear. What truly helped me was not medical authority, but listening to intersex people themselves and building a safe community for my child in my country. If doctors spoke with honesty, humility, and respect instead of creating fear, many parents would not be traumatized as I was at the very beginning of our journey, and many human rights violations could be prevented before they ever happen. I have to add that in Greece, we are the sixth country, supposedly, globally, that managed to pass a protective law in 2022 to ban IgM for intersex minors under 15. But sadly, due to political conservatism in Greece, this law is not yet really implemented. Heike.
Wow. Yeah,
Yeah.
thanks for sharing this. It's very not an easy journey, and yeah, so people to understand how difficult it for our parents. This is also the reason why I decided to come out, because I don't want our parents to feel bad to have us, right? My parents used to feel guilty and feel sorry for, say sorry to me, and I feel that it's not necessarily, for them to feel guilty all their life. It's really, really a torture for them. So we shouldn't continue in this way. Okay, and uh, then after your child grow up, as a mother, never heard about intersex variation before, and a society that predominantly assume they are only sex or gender binary. Uh, what are the primary challenges and what uh, what suggestion do you have for parents on raising an intersex child, specifically from age 0 to 10, within the family, community, or school environments?
Yes, actually, I will speak to all ages, children ages. I mean, even after 8, even after 10 years, because some children are learning, some families are learning about the intersex condition after that age in puberty. So one of the first things many of us learn as parents of intersex children is that our children become our teachers. They teach us that bodies are diverse, that development is not a straight line, and that health is not about fitting into a narrow norm, but about feeling safe, respected, and loved, body and mind. This is what my intersex and also happen to be non-binary child is teaching me every day. The primary challenge we face is fear-based decision making, especially when doctors pressure us to act quickly. We are often told that we must fix something now, or our child will suffer later. What we learn, often from intersex adults, is the opposite. Rushed, irreversible decisions are what cause the real harm to them. This is why many of us choose to stand by our children by protecting their bodily integrity. We decide to postpone non-urgent medical interventions and to center our child's future autonomy and consent. This decision supports our children's healthy growth, not only physically, but also psychologically. Children who grow up knowing their bodies are not a problem, are natural. They develop stronger self-esteem, trust in us parents, and confidence in the world. Another major challenge is silence and invisibilization. Parents are often advised to keep intersex a secret, even from the child. We learn instead that honesty, in age appropriate language, of course, is a form of love and care. We talk openly with our children about their bodies, answering questions as they arise without any shame or medicalized fear. And always with our child's consent, we can decide if and how to share information with extended family or schools so that our child can be safe and included while being themselves. Schools are often one of the most difficult environments for intersex children, especially in countries like Greece, where inclusive and comprehensive sexuality education is totally absent. Intersex children are invisible to the system, and invisibility makes them vulnerable to bullying and exclusion. As parents, we often have to step in and educate teachers and school staff, explaining that sex characteristics vary and that no child should be singled out or medicalized or even exoticized. Our message to schools and teachers is simple. You don't need to be experts. You need to be respectful, protective, and willing to learn. And also doctors play a crucial role here. What we need from them is not authority, but partnership. We ask doctors to stop pathologizing healthy intersex bodies, to provide clear, evidence-based, non-alarmist information, and to refer families to intersex-led peer support instead of isolating them in fear. When doctors support parents in waiting, listening, and learning, they help families make decisions that truly serve the child's best interests. In the end, raising an intersex child teaches something profound. Our role as parents is love our children unconditionally. It's not to normalize their bodies or minds, but to protect their right to grow, to decide for themselves, and to thrive as who they really are. Thank you very much for having me here today.
Yeah, it's very touching for me. Please give me a moment. In my personal experience with my parents never tell me about what my body is. They have no energy and the courage to share that with me. I also feel that it seems not a good idea to mention my question about my body with them because they always cry. I'm very happy that we have parents of intersex children came out and, and stand up to speak for us. I hope that we can not only protect our intersex children in the future, but also support our parents. I believe if we can, if the society can support our parents properly, then then intersex children can have, their life can be secure.
Yes.
Ah, okay, it's
Th-
uh,
Sending you
thank
the
you,
biggest hug, the biggest mommy hug.
thank you so much, though, and thanks for joining our panelists. Before we move forward, we welcome all the audience to raise your question in the chatting box. We have Q&A time later after all the panelists speak.
I think
Sorry,
you are on
sorry.
mute. No worries. Yeah,
Yeah,
you take your
I,
time.
okay. Yeah, we just heard that it's quite difficult, for parents to educate and to, accompany our intersex children when they grow up in the school. The next panelist, is also a great person that we also feel honored to invite her to join us. Uh, it's Kushmi Chakra Chakraborty. Sorry that I'm not really good at pronouncing. Yeah. Okay. School actually is the first social environment a child encounters. In a school with only educating two sex or gender roles, uh, intersex children may face many unexpected situations or even harm at school. How to create a safe and friendly environment for intersex children in school, and it is a crucial yet almost completely overlooked issue. Today, we invited an advocate dedicated to this issue in India to share her insight from her work. Koushumi is the co-founder and director of Intersex Children's Foundation of India. Maybe most of you never really concerned about this issue. Please remember this foundation. And she is a dedicated advocate for the rights of intersex children in India, working to protect them from stigma, discrimination, and non-consensual medically unnecessary intervention. Her work also focuses on supporting families through rights-based information, ethical healthcare engagement, and community-led advocacy to ensure the dignity, autonomy, and the well-being of intersex children. Kashmi, the fact that you adopted an intersex child is incredibly courageous, especially within Asia culture. In a society where people who don't fit a sex gender binary are often unwelcome, and many feel pressure to hide, normalize, or even abandon their intersex children. This, this is a very brave act. Could you share with us what preparatory step did you take before deciding to adopt an intersex child? How did you manage any associated pressures?
Thank you so much, Hiker. And Irene, Hiker, I totally, feel the same kind of pain that, your words have invoked in all of us, I think, whether as children or as parents, I think all of us feel the pain. When I decided to adopt my child, the child's being intersex was not really a concern for me. For me, a child is a child, and every child deserves the love of parents and the love of family. So I didn't really have to think about it. But yes, when I was first informed that my child is actually transgender, and I realized I didn't know what intersex is till I was 38. So, Sanjana, you're not the only one. So, but I still knew that the child is not a 3-year-old child is not transgender, but I didn't know what DSD and all those pathological terms in the medical reports meant. And when I was doing my research on Google, etc., I found a lot of information that was available from the Americas, from the Europe, from Australia, but there was really nothing available in India from an Indian context. The only thing that was available in India were a lot of scientific research papers, uh, which for an English literature honest person like me flew completely above my head, and I couldn't make anything out of those. In terms of my family, something that my brother told me at that time really stuck with me, and I realized the reality of it or what it actually meant much later when I did, bring my child home. Is that he said that, you will have to walk this path alone. You will not have any resources, any information, anybody that you could go to for counseling or for advice. Whatever you decide to do, you will have to decide on your own. And as a parent, my initial months of being a parent, I realized how lonely this journey can be, because you go to doctors and the doctors are using pathological jargons, and quite a few of them are kind of emotionally pushing you towards doing a surgical intervention, etc., and you actually have nobody to go back to seek advice or to brainstorm with, that this is what I'm being told and how much of it is true, not true, what should I do. And I was a single mother, so my loneliness was at a different level. But it also got me thinking that when we blame parents for aborting a child, or for abandoning a child, or for forcefully making them go through surgeries or other medical interventions, we are probably not being fair to them. A mother or a father is as old as the child is, and they become the mother or the father when the child is born. They don't know any better than the child. So they only know as much as what is told to them by, their families or doctors, etc. So for me, that was a motivation to start the advocacy work. But I started the advocacy work with the intention that I need to support the parents and the families so that they have a choice. Right now, whatever decision they are making is because they don't have a choice. So they should have enough information, enough support, enough encouragement to know that they are not alone, and that they have an alternative choice to make. So honestly, I there was nothing that would have stopped me from adopting my daughter. Um, but yeah, but the challenges started after I brought her home, right from my immediate family members to medical community to the educational institutions, etc. So all those were practical challenges that I had to face, and hence I started this organization. And the organization aims to build awareness and build support systems, awareness amongst healthcare professionals. Even healthcare professionals, most of them are very, very well intentioned. It's just that they have never been taught this in their own curriculum. They have never been taught how to, deal with such situations themselves. So even if they have the good heart, it is important to give them some of the resources also that we, from our practical experience, know today, which we also didn't know 10 years ago. So my our first this thing is aim is to help doctors and medical fraternity in getting more information, best practices, and also a guidebook for parents. Specifically, how do you deal with those questions that come from immediate families or from the schools or from neighbors or from your child's friends and peers? How do you tackle each of the questions? How much information do you need to give? How much is too much information and you don't need to give? So, for a new parent, these things are very, very crucial to know. So, I hope I was able to, um, you know, tell you about how my journey has been.
Yeah, thank you so much. This is very touching because you don't only, consider yourself, you also see that there are other intersex parents will definitely have the same experience that you have. So you want to help them. Thank you so much to start this journey and this being our ally. And I think already you mentioned about the education. I feel I discovered that the education you are talking about is not only at the, at the school, but also about the education for the medical professional, right? And so, the beside that, what what do you see that in the at the school, uh, the challenge is and the risk or gap are there, you know, that could be impactful to the mental health of intersex child and their family. How is it situation in India? And do you have any uh, s- any idea, or you done anything to address this and improve
Yes,
this issue? Yeah.
yes, yes. So I'll tell you about some, I'll give you some examples of how daily life at school happens. So, for example, in activities in the primary school, um, there are classes being held which at a very early age, as early as 2 and 3, are meant to form gender identity. So, for the first time, when I went to my child's daycare and I saw a couple of posters which said, "Am I a girl or am I a boy?" And this daycare was meant for very, very small kids, right? Toddlers, rather. Then things like the kind of toys that are given to boys versus the kind of toys that are given to girls. Um, then the complete lack of awareness about what intersex is. intersex is confused with transgender till date 99.99% of the time. um, and hence when you go and say that my child is intersex, um, all the DEI and inclusivity and equity, which is purely in the mind, does not really percolate down into the heart or the real practices. I was told by school principal that no problem, your child can use the handicap toilet. And that school prides itself on diversity and inclusivity, right? So it's just a matter of ignorance and lack of awareness, I feel, not so much as the lack of intent or lack of heart, but I think it's just that people do not understand what it means to be intersex. Gender identity is mixed with sex identity. Uh, Even the most educated people do not know the difference between sex and sexual. So, in a lot of places, you will see it written as differences of sexual development, and not differences of sex development. And then sex is equated with, conflated with gender. So, unless we really focus on building awareness in the schools, the daily discriminatory practices will not go. So I didn't realize, I mean, when I was growing up, and I have a brother, so it was natural for me that my brother was always given the bat and the ball to play cricket or the football. And I was always given the kitchen set and the tea set and the Barbie dolls. Uh, it didn't really hit me till I had my child, and I took my child to the to the child counselor, to figure out what would be her preference, gender preference. Um, and the child psychologist tested her with toys, and that's when it hit me, and I was like, toys have a gender? I didn't realize that till now, but yeah, we are all products of our own childhood, right? So, yeah.
Yes, you are right. I think the uh, confusion between intersex and transgender is really a big issue. Although that these two are different, but also people still don't quite understand. And
Mm.
also create a big trouble in terms of legal rights, right? I think in South Asia, this is such a such a issue that we need to work on it. We don't we have to know that there are intersex trans people as well, which means that there are intersex people who identify as trans, but it doesn't mean that intersex equal to transgender. It's different. Gender role is social is a
The
gender role
social,
is
cultural,
role. Yeah,
psychological, yes.
the
Yeah.
sex is a biological. So these two
Yeah.
are different.
But
I
I
hope.
still have a lot of hope, because I have also come across a lot of educationists who might not know anything about it, just as I didn't know anything about it. And I think Irene said this, and I 1000% agree with her, is that our children are our teachers. So I have learned whatever I know about intersex from my child. And if a teacher turns around and says, look, I don't know anything about it, but can you tell me? That itself is a matter of hope for me. That, a teacher who is eager to understand gives me hope.
But at the same time, I feel there's a risk right now. The whole world is more and more anti-transgender. This also is my concern. Although
Yes, that is there.
yeah, this is my concern because we also love not we love intersex people. We also want to defend the same rights for trans people.
Yes,
Uh, yeah, if their rights are face backlash, I think it's the same for us. We will also feel
yeah.
feel the same.
But I've
By
always, yeah, my experience has been, um, I prefer dialogue. That I would talk to people, and it might take me longer, but I think over a period of time, with consistency and with dialogue, we can break these barriers.
I totally agree with you, and thanks for you are willing to stand up and to talk. This is very valuable for us, and thanks for being our ally always. We really appreciate.
Thank you.
Yeah. Okay. We and now I feel much better because we have many powerful allies here that supporting us. Okay. Now we'll go to the last panelist, introduce the last panelist today. After hearing all the voices from adults, it's time to listen to the voice from the key role of our panel, an intersex person sharing about their view on childhood experience. Now that we have heard the perspective of adults, it is crucial to turn to, oh, sorry, okay, I think I will read this. Okay, Maliha Sarah is our distinguished guest today to represent intersex person. Maliha Sarah is a distinguished intersex rights advocate and the founder of executive director of Bangladesh Intersex Forum, the first intersex-led organization in Bangladesh. Maliha, I know that it is not very easy for an intersex person to share their life story publicly. Really appreciate your courage and your agreement to join us. Uh, um, how we want to learn, about your early age, from 0 to 10, your childhood life. How is look like? And because intersex children are the most vulnerable group in our webinar, actually the panelists, right? This webinar actually aims to learn from your childhood experience as an intersex person, so we can help the society to understand and improve the living environment of intersex children. So, thinking back when you were little, what are the impacts when your family make decision to assign your sex without your consent? What do you think that it can be done better? This is the first question for you.
Uh, Thank you, Hiker. Uh, when I was born, and my father and mother, and also my doctor don't understand. I'm a not a boy and I'm not a girl. When they check my personal genital, discrimination that's towards. It's really when my grandmother telling me the story, and I'm really curious actually, and I asked several times what happened that time. So so all of people was very upset, and and they are very confused what can they do. So I born and brought up in Bangladesh, and Bangladesh is a 95% is a Muslim population and is very patriarchy society. And they put me a my sex marker as a male, and doctor identify this one is a DSD. I mean sex disorder of sex development. I mean that mean it's a one kind of disorder. When they inform me that my parents is a one kind of the disorder, in our social perspective, my parents are very social, economical, and politically sound. So they try to be fix it. They try to be fix it. So that's why they try to be force me in the doctor. And it was very horrible experience I faced every time they check my personal genitalia. I mean, I was a kid. I deserve I deserve um I deserve the normal childhood. So everyone deserve like that. So but it was not happen with me. Not only that, they bring to with me also the religious leader. So they put me also the holy water in just like that. And not only that, I was actually isolated in my house. With that, I cannot participate in my any family program. So if I go anywhere, people look at me very different way. One day, one people came and look at me, look at like that, and say that, "Oh, I came here to look at you." So what I am, I'm not the different one. Actually like a kid. They said, "Oh, I'm coming here to look at you," and and I said that that's actually I'm just trying to looking for the answer. So why people look at me? Why people look at me? What is the different from me? Some people try to give me a chocolate and try to pull up my pant to show my the genital. And they behave like a very different behavior with the other people. So lot of kid also behind me, they did not face that type of behavior, but I faced that type of behavior. And I feel like oh my god, I'm an alien. I came from the other world. Maybe they actually like that. I went that I mean when I was actually the kid, so then my family teach me. So they are very concerned about me. Um, so they really worry about our the family reputation and that type of thing. So okay, so they teach me that how to walk. I mean, I really don't know that boys have a really walk pattern. Men have a really walk pattern. And also boys cannot use the pink color. They they said that, oh, you sit like that. No, no, no man sit like that. You have to behave like a manly behavior. You have to walk like that. So it was very frustrating. I really don't want to sit like a man. I really don't want to sit like a woman. I really want to sit like a me, whatever I want to sit. And not only that, every time they forcefully take me in the hospital, and hospital doctor told me that, oh, it's a disorder of the sex development and that type of thing. I mean, I have really no complaint about my body. I'm really happy about my body. I mean, it doesn't give me any pain, any headache. And I really don't know why I'm going to the hospital. So some people and also when that time when the doctor actually checked my the personal genital, people are so much curious. The nurse, the other people, they do really crowd that like that. I mean, the OT place and that like that. I mean, whatever, I'm kid. I deserve also the privacy. But the doctor think that, oh, it's a kid. Why you need this the privacy? I'm not talking about the Western perspective. I'm just talking about the Bangladeshi, like that, the Bangladeshi doctor protocol, Bangladeshi doctor or South Asian privacy system. I don't have this privacy. It's really, really hurt me. And it's still it give me a lot of pain. And even that, when the doctor identify me as a disorder of the sex development patient, and I mean, when I was a kid, I'm thinking that, okay, so disorder of the sex development, I mean, why is not the diversity? I mean, is the rose can be red, rose can be white, rose can be yellow. So why not the man can be like that? When we can see that the human diversity, why people do the lot of complaint? I have no complaint about my human body like that. So when I was under 18, my family forcefully cut my uterus and ovary. They give me a forcefully testosterone hormone because, and they try to be make sure my facial breath and that type of thing. And it was a very horrible experience. And I have to make, because I have to wear the boys dress, I have to make sure, I have to, everywhere, because in our South Asian, they have a very specific seat, like the boy, woman. This is the, the moon and sun. They actually make a difference like that. They divide it like that. But I mean, I face a lot of the sexual violence, sexual abuse when I use the public transport. I face a lot of, I mean, even that people are not familiar regarding this issue. So I'm very puzzled and I'm thinking that where I go and where I can complain. And when they I try to become, oh, you are kid, just stop your mouth. And that time I have no also that opinion to share my opinion, and no one listen my actually opinion. And when I go to the doctor place, I strongly feel that there is no collaboration with that psychological, psychosocial evaluation. So like that, when the surgery field and they send me that, okay, endocrinology, urology, they send me like pass me a ball like that. I'm feeling like a football. And after that, no one can, I mean, take care my psychosocial well-being. How actually I'm going, in generally I grow up actually the uterus ovary, and that time they did not ask my concern. They asked about my they asked my parents concern because I was under 18. because legally in our constitution and also South Asian constitution, they said when your child is like that, your child cannot give you consent. Your parents' consent is your child consent. So it was a horrible experience that we face. And right now, it is more horrible because right now in our country, they open a disorder of sex development department. And our doctor declared it. They fix the sex and they said that, oh, this is very proud. This is very, I mean, they did really good job. Most of the parents, they bring their kids and they are most of the, I mean, under 10. And they said that, doctor, I bring my kids, make my kids as a boy. Because in our social perspective, as a boy rises is a make easier their life. Because it's a very patriarchy society, Muslim patriarchy society. Can you imagine? So last 22 years, I grew up as a boy. I went the boys' restroom. I went the boys' hostel. I went the boys' room. I mean, because in our South Asian, they divided like a boys and women, like a moon and sun. So it was a really horrible experience. Yes.
Thank you so much, Maliha. This is not an easy journey. And let me tell you, this is a very common experience for many intersex people, not only in Asia, but globally. So we really need more people to understand how uh, what's the experience of being an intersex person, how the society ideology on gender and sex binary restricted us and even harm us. I, we know that you don't do it intentionally because we all face the same brainwash. But I like what Rinio and Maliha and all the panelists share us today. Intersex existence actually can teach us how diverse human beings are, and everyone actually have unlimited potential to develop a uniqueness of being of yourself. I personally also embrace this idea so that I feel proud to be an intersex person, and we intersex people, I believe, can bring this important message to all human beings. Not only us are beautiful, our abundance, are diverse, but also you. We just our mind just stick into the gender and sex binary only, like we were taught to be this and to be that, and only two kinds. It's a pity. Okay.
Yes.
Yeah. Thanks for Maliha's sharing, and all our guests sharing. It's very fruitful. Now I think we come to the okay. We only have 10 minutes left. I think we can open to question. So we can let me see what are the question. Okay, let's have the question answer the question by order. Uh,
Yeah. Hiker, maybe I can help you with the question.
okay,
So,
yeah. I need to look for
yeah,
it. You
yeah.
help
No
me.
Yeah, thank you. The first question, and I think any of the panelists can answer, but I think this one is more related to medical. So if Dr. Kanishka can pitch in. So Swati is asking, how do you define a newborn as intersex, ambiguous genitals? And I think a lot of people have this, what do you mean by ambiguous genitals? So if you could just explain a little bit more about that. And Swati also asked about what percentage of people are intersex.
Yeah. It's an old terminology, ambiguous genitals. We do not use that anymore, in line with the recognition that it can be a diversity there. So to be more inclusive, the term that is used now is atypical, not ambiguous at all. And an atypical genital child born with that may be someone who has a difference in sex development. It may be someone who does not have an atypical genitalia but yet have a disorder of difference in sex development also. So the way we go about evaluating them is a routine way of a detailed history. There might be clues in the previous in the parents or the previous siblings, etc., the previous pregnancies or the current pregnancy. And then we go on to clinical examination. Based on the clinical examination, we do some very specific directed tests, not a whole panel. There is a step ladder algorithm in which we look at different things, notably the karyotype. You must be familiar with that, 46XXXY, or the other atypical ones. And then we look at imaging and endoscopy to see what the internal genitalia are. So we have an idea of the external genitalia, the internal genitalia. Then we select a very select group of hormones to look at to see how functionality is being maintained. And then after all this, we put together all the information to come to a diagnosis. Even after all this, and we also have the very important person, the psychologist in later childhood, to tell us about the evolution of the mentation of the child, the establishment of gender, etc., the role, the social role, and so on. Putting all this together, we come to a conclusion in barely around 25 to 30% of the common type of DSTs. In some, we have bigger figures, but barely in that. And now, of course, additionally, we have cytogenetics, genetics, in a way, exome sequencing, etc., which gives us a more pointed diagnosis. Even then, barely in around one fourth to one third, we actually get at the diagnosis. But broadly, we can say in the majority that this is the probably the line which will be in future, and this is what we should do, because our aim is entirely to pick up those who are in the danger of life threatening situations or organ damaging situations. We pick that up first and address them, and the rest we go slowly. So this is how we go about getting a diagnosis in special centers with people who have been working on this for some time. It's not an easy job at all. Yeah. And what percentage? Yes, around uh, the generally congenital malformations, which are malformations by birth, constitute around 3% or so of all live births. That is in general around 3%. So this is of that 3%, it is less than 5%, or even less than that we have differences in sex development. So it is very, very rare. And of course, the figures differ for each of the particular types. The common one that we have is the congenital adrenal hyperplasia. That's a common one. But then figures differ.
Thank you, Dr. Kanishka. This also, yeah, Rinio, you want to say something? Please go ahead.
Yes, I would like to add that the percentage is a number that if all babies had karyotypes or been diagnosed, we would have a different, larger number of larger percentage of intersex children in general. Because right now we know that only around 25% have a diagnosis in child ages. So I believe that, empirically speaking, I believe that we will see a rise to the percentage up to maybe 4% in the future as more tests are starting to be done to newborns. Thank you.
Thank you, Rinio. Um, The next question that we have is from Siva. And before I move to that, I think in terms of the medical terms, like how we explain what an intersex variation is, that is one part of it. But as a parent, how do you explain it to a small child? Like we talked about, to have honest conversation with the child. So the first part is, how do you tell the child what intersex is? Like how would you just explain, like, if imagine there is a child, so if one of the parents, Dr. Koushumi or Rena, could answer this. And the second part, which Shiva has asked, is that questions about marriage and having children come up very naturally in our society. And I notice a lot of curiosity, especially from students, about how these questions relate to intersex lives, about marriage and having children. So, based on your experience, how can we respond in ways that are accurate, respectful, and affirming? Either of you could answer.
Hi, Irene. Would you like to go first? No?
Yeah, why not? I explained to my 5.5, when they were 5.5 years, I explained to my child that all bodies are unique, that difference in our bodies, it's something natural and common. Unfortunately, we don't learn at school what we should, but the truth is that I have a different body as a girl, and another girl has a different body as she, and this goes like that. And also, I came across to a nice animation about chromosomes of the BBC channel, and for children. And this explained to my child in a happy way that chromosomes are not just XX and XY, but for girls and boys, but it could be any combination. And I told them, you are like this, I am like this, your dad is like this, our friends are like this, and so on. So my child learned in a pleasant way that the difference is natural. It's okay. And the other question was, sorry.
Yeah, if I think, thank you, Rinio. I think
Oh,
if,
about
Kaushal-
marriage. About
yeah,
marriage.
about
That's
marriage.
Yes.
Yeah,
right.
yeah.
Because I knew that XXY children, at least half of them cannot bear natural children in a natural way. I explained to my child from a very young age that people can be parents in many ways. I spoke about abandoned children. I spoke about how every child deserves a family. So my child now in puberty is thinking sometimes that I would like to give a family when I grow up to an abandoned child, and I could be a parent like everybody if I want to. So this is how we solve this.
Thank you. Kaushumi, would you like to add? Or I
Yeah,
could.
um, yeah. So I just wanted to say about children, they're much smarter than we give them credit for. So having open conversations with them, trust me, they will understand much more than we even understand. So having age appropriate, but at the same time, honest conversations go a long way. No two-person has the same fingerprint or the same DNA. Then how are we expecting, everybody to have the same kind of bodies? Even two men or two women don't have the same bodies. So diversity is a reality, and I think children understand that better than we think they can. As far as marriage is concerned, it is important to understand the entire medical details about a person, because not all intersex people are incapable of having a regular sex life, or incapable of having children, or not every intersex person is impotent or sterile. Certain variations might cause complications, but again, these are conversations that should be had along with medical professionals, with all information available regarding that particular person's body, inside and out. However, as Rinio very nicely put it, uh, there are many ways to be parents. A parent is somebody who loves you unconditionally. And that unconditional love, I don't think, is tied to the blood or the flesh. So if any of us want to be parents, love is what is important and not your physical attributes.
Thank you, Koushumi. That was very beautiful. Um, there's one last question that we will take, and if Hiker and Malia can come in, but briefly, if you could do that, it's already 7. Megan is saying that I would like to thank all the panelists for educating us and putting themselves out there. My question is that at what age is it appropriate to start having such discussions with children? Something I came across a lot of people saying is that it is inappropriate to put forward words like intersex or what intersex means. And a lot of people have misconceptions that simply educating children about intersex and even the LGBT community is harmful for young people. They claim that it has something to do with the children reaching puberty sooner than expected. Do you validate such claims? So if a hiker and Malia could speak from your childhood experience.
Maliha, do you want to, yeah, what do you want to answer? Okay,
I mean, Hiker, I think you can go ahead.
okay.
Yeah.
Okay, in my opinion, I feel that we should let intersex be this knowledge to be normalized, become a common sense. When we start to learn about sex, we should be included, right? Male, female, intersex people, and intersex people are also there are many different variation. This is a natural, right? Why we hide ourselves to a natural, you know, variation? Why we feel shame about that? If why we need to hide it? I don't think there's a need. If my dream actually, uh, if our education can include intersex when we were little, when we are playing the rubber duck. Do you know the rubber duck, the yellow the yellow duck? When we are little, we played that. If we can learn uh, about male and female intersex at the same time, when we are playing the rubber duck, it because the duck, the duck actually has no gender, no sex, right? We can and there are so many different colors, right? So why can we just learn it from then, from the beginning, so it become a nature part of us, so we don't need to feel fear, right? We don't need to feel fear. I think the problem of the binary, ideology, just tell us, okay, okay, because they are only two, so you are born in the wrong body, and when you grow up a little bit, then you discover, oh, you love, the same sex people like you. Then people tell you, oh, you love the wrong person. Then, if you identify with the opposite gender that you were assigned at the birth, then people say, "Oh, you get wrong about yourself. You don't understand who you are." But who is the one who is the one who have this autonomy, right? We should have, everyone should have their bodily autonomy, not only bodily, right? LGBT, these, right, sexual orientation, gender identity, these are all part of diverse human sexuality. It's not, something, weird, because we are honest to ourselves, especially to people who we love, right? We didn't know when we we didn't know when we love someone who are considered the same sex as us, uh, is called homosexual. I didn't know that. I have the experience, so I didn't know there's a homosexual and it's not correct. It's not right. No, you just feel okay, you're attractive and you just falling in love. It's not because you want to be something that is bad or you love the wrong person. I think the society is very limited in their idea. So I think these are wrong. These are all part of human sexuality and sexual orientation, gender identity, gender expression, and sex characteristic. In all this, we need to have our right of autonomy.
Yeah.
So I
Thank
don't
you.
think
Thank
it's a,
you.
mm,
Yes. This also reminds me one thing that Dr. Sangeeta said in one of the conferences is that the right age to answer a child's question is when they ask it, be it at the age of 2, 3, 4, whenever the child asks it, it's important for the parent to answer it honestly. Thank you. Dr. Kanishka
Uh,
and Kausham, please, your hands are up, but also the time. So if you could, yeah,
Yeah, I'll just
please.
quickly clarify a few things. We just discussed about sexuality and fertility. Yes, we have information on these in many of these differences in sex development. Sexuality is something which is possible with many of these children as they grow up, but with right intervention at the right time, including medications, etc., and counseling, very, very important counseling. Fertility is restricted to a small group, the group in congenital adrenal hyperplasia, not so much in the others. And generally, children, like you said, they whenever they ask is one thing. Otherwise, by 3 to 4 years, the psychologists who deal with these, we have Dr. Vijaya Raman in Bangalore who does it, and some who very carefully deal with this. By third to the fourth year, they can get an idea about the gender of a child, the way the child thinks, its social role, etc. And by 7 years, it sort of crystallizes, 7 odd years. So this is a general thing, but it varies from individual to individual. I just wanted to add these broad things that we already know.
Thank you, Dr. Kanishka.
Thank you so
Kausham.
much, Doctor. Yeah, I completely agree with you, Sanjana, over there, that, the best time to tell a child is when the child asks questions. But I think one thing we can inculcate in our children, irrespective of their age, is to have respect for every life, for the dignity of every life, for differences and diversity. If that is inculcated from day one in a child's life through example, then I think the child will, ask the right questions at the right time. And the second thing I wanted to say is, we always in our society, especially in the South Asian, I don't know about the European society, Rinio, but we think that our children get influenced by the peer a lot. So it's like, oh, my child picked up smoking because their friends were smoking. So being lesbian, gay, bisexual, transgender, or intersex is not something that you become because your friends are lesbian, gay, bisexual, transgender, or intersex. So intersex is not caught. It's not a disease. So, by answering your child's questions, trust me, your child will not, if your child is not intersex, your child is not going to become intersex at some point because of influence or confusion. That's all I wanted to say. Thank you.
Thank you, Kaushami. I think very valid points. Malia, last few words, but very briefly, if you can.
yes. I want to say that one thing is that two or three question is very arise. Sexuality and fertility and that type of thing. So a lot of people thought that, oh, intersex people are maybe the asexual or that type of thing. That's not true. They are sexual active. A lot of people, first of all, intersex is a sex characteristics, and they identify a lot of gender identities. So we should uh, actually we have to make sure that it's a different sex characteristics, so they they can be identify a lot of gender identity. So yeah, and I mean, if they identify the it's a different sex characteristics and it's a biological different, so uh according to my point of view, they are not capable to fertilize the um they are not to fertilize like cis woman or cis man. So that's the another point of view. Yeah, that's it.
Thank you, Malaya. And as we come to the end of this session, I think it was beyond a session. It wasn't just conversation or just theories. It was the real experiences of people who have been part of intersex journeys, either themselves or as a caregiver or as a doctor. And I think personally, when I heard for the first time the panelists, I cried. And today also cried. I think it just like your experiences, I think we cannot say as non intersex people that we understand, because I don't think we can understand unless we are in that position. But like having so many people here on the call, and I see that consistently people have been there, people have not left, that means that we as a society is also taking a step to be part of these conversations to start with. So, thank you to all the panelists first for bringing your raw self. And I know that sharing your personal experiences, your lived realities is not easy. And as you got vulnerable, emotional, that actually shows that, the hurt is still there. And that hurt will take some time to heal. And it's not just your work to do the healing, but as a society, all of us have to come together to be part of that healing journey. But a big thank you to all of you for being yourself, for showing up as you are today, and for giving us so much information, and not just information, but just connecting us to some bits of what it means to be an intersex person. So, thank you so much. And also, a big thank you to Hiker for moderating this and for being part of this conversation. I know it wasn't easy, Hiker, uh, but so much power and strength to you. You didn't have to be strong, and you did give yourself the space to be vulnerable. So, more power to you for doing that. And as the parents joined us, again, no, it's not easy conversations to do that when you have children and who are being not treated well by the society, but still taking up steps so that other intersex children can be supported. What your children went through, what you went through, other children and parents shouldn't go through that. So a big and a deep thank you and gratitude to all of you to be part of this conversation. And lastly, I think I'll just end with saying that as we started, that nature has so much diversity. There's so much of differences. But nature never says that we need to discriminate based on those differences. So I hope, we can take that with us and start this conversation in our own spaces and embrace each other with more love. So we'll just end it here. No more theories, no, nothing about global coalition. Thank you. Thank you for being here. And please take care of yourself. Dr. Sangeeta, anything you want to add at the end?
No, nothing. Just a lot of love and a lot of respect.
Yes. Thank you, everyone. Please take good care of yourself. Thank you for joining.
Love and respect to everybody. Thank you so much.
Thank you, everyone.
Thank you so much for this great opportunity.
Thank you so much, everyone.
Thank you.
Thank you, Thank you.
Lavni, could you please end the meeting?